The Community Scorecard is a social accountability tool that uses community and service provider meaningful engagement for service utilization and delivery improvement. Often, it is used as a community monitoring and evaluation tool to improve service delivery and utilization. In this video, we will take you through the steps of how to develop a community scorecard. The examples we shall use will be for health services. The scorecard has about 5 steps while we're developing it. The first step is preparatory groundwork. Step number 2 is the health facility scoring. Step number 3 is the community scoring. Step number 4 is what we call the interface meeting. Step number 5 is the dissemination, monitoring, and evaluation. So we'll now explain the steps in detail. Preparatory groundwork. Under the preparatory groundwork step, we do planning, input tracking, and sensitization and mobilization. In planning, we want to secure buy-in from the different stakeholders at the local level in the communities, in the sub-counties, the districts, the national level, but also other stakeholders like civil society organizations that are going to help us in implementing the community scorecard. And we do this through meetings. The second thing that we do is to define the scope of our work. What geographical coverage are we looking at? What services are we looking at? Like health, are you looking at water and sanitation, maternal and newborn health like we did? Or are you looking at HIV? The next thing that we want to identify is facilitators and train them. You should get facilitators and people who understand the languages in the place and will be running the community meetings. The last step in planning is making sure that we prepare logistics, venues, materials, and things that we shall require in the meetings. So let's look at the second thing that we do under the preparatory groundwork. That's input tracking. When we want to develop a scorecard, it's very important to look at what are the inputs for the services that we are trying to assess. What is covered in the different levels of service. In a health center too, how many health workers do you need to deliver a certain service? If it's a health center 3, it's the same. You do that for all the levels of care that you are trying to assess and improve performance. So the third thing that we have to look at now under the preparatory groundwork is community mobilization and sensitization. We have to first of all make sure that communities and all other stakeholders understand their rights and responsibilities in delivery and utilization of the services that we're trying to assess and improve. This is the time when we do radio talk shows and other meetings to make sure that communities understand and mobilize all participants from the community to participate in different meetings of the scorecard. At this stage, the facility identifies and selects the indicators that it would like to improve and then scores its performance. It is done in the same meeting with the tracking exercise if it is the first meeting that you are convening. And we will look at the steps in the health facility scoring now. So what do you do before convening the health facility scoring meeting? You determine a suitable time and place for the meeting together with the facility leadership and ensure that everyone involved in the service delivery, right from the senior staff to the security and administrative staff, participate. You prepare all the materials that you need and you identify the net takers. At the meeting, you need to explain the process of the community scorecard if it's the first time of the meeting. You need to explain the objectives of the health facility scoring to the health workers. You then work with the health workers to identify, prioritize, and select indicators that they wish to improve. You choose a scoring method and an objective criteria for assessing each of the selected indicators. Ask the providers to rate how well their service performs on each indicator and record the results on a paper. Guide the discussion to identify why the service providers give the scores that they did and elicit suggestions for improving these indicators. You can then draw up your scorecard and your proposed work plan. We are now going to step number 3, of developing the community scorecard, and it is called community scoring. What do we do in the community scoring? Before the meeting, again, you need to identify a suitable place, a venue, together with the leaders, who may be officials like the community development officer, the health assistants, the village health teams, and the local council one chairpersons, to select and mobilize participants of the male and the female focus group discussions. At the meeting, we explain the community scorecard process to the community. If it is the first meeting, it's very important for them to understand the objectives of the meeting. Briefly present and discuss the input tracking matrix that was prepared in our step number 1. At the first meeting, brainstorm the key local problems and then prioritize and select key issues that will be the focus of the community scorecard, and develop indicators that will be used to assess the progress in addressing these indicators. Choose a scoring method and objective criteria for assessing each of the indicators. Scoring can be done using various methods that include colors, smiley faces, percentages, or numbers. The method that you choose to use should be very simple to the community to use and understand. Then ask the community to score each indicator using a participatory approach. That could be raising of hands, getting consensus, and recording the agreed score by the group. Ask the community to explain why they gave scores that they did for each of the indicators. You then ask the communities to elicit suggestions that they might have for improving the conditions for each of the indicators that they scored. You could also draw the scorecard at this point in time and their proposed work plan. Invite participants to the interface meeting and explain what will happen while in the interface meeting. Now, let's handle step number 4, interface meeting. This is basically a joint meeting between the service providers and the communities they serve. It will include political leadership, technical leadership at different levels, civil society organizations, religious leaders, and other community leaders. Before this meeting, together with the local leaders and the sub-county leadership, you need to establish the right dates, the time for the meeting, mobilize everyone from the community and all key stakeholders, prepare all the materials that you need, and identify a note-taker or a secretary for the meeting. So at the meeting, representatives from the community and service providers present their different scorecards and work plans. The meeting then discusses the scorecards of the community and the scorecards of the facility, either agree with the scores or modify where they deem necessary. In the meeting, they also discuss the work plans of the community and those of the facility and modify where they deem necessary. Final scorecards and work plans are then drawn to improve performance. Something to note here at this point is that we can combine the community scoring and the interface meeting into one after the first scoring. It reduces the number of times that the community has to be called for meetings and also reduces the burden on the facilitators of these meetings. So you did your preparatory groundwork. You did facility scoring, community scoring, and the interface meeting. The last step now is to disseminate, advocate, and monitor what you have been doing. We follow up on what is agreed in the scorecards and in the work plans to see what is happening. We bring together the district, the sub-county authorities, as well as representatives of the different health facilities and implementing partners periodically to share progress with the implementation. We share scorecards and work plans from the different communities and the facilities. This is the time to lobby for support from the local government, the national government, the civil society organizations, and other partners to help us improve service delivery and utilization. The district and national level advocates will help us to advocate at higher levels of the district and the national level, while the civil society organizations who work within the communities will help us with community advocacy. The political leaders at the communities also lobby in their areas of jurisdiction. The community scorecard outputs can be summarized in shorter documents like brochures, like briefs, and media like newspaper and radio talk shows on YouTube and blogs. And in this way, the community scorecard work gets spreading. If you go through these 5 steps, then you have developed your community scorecard. It will help you with service delivery and utilization improvement. Thank you.